My name is Jill, and I'm a Senior Grant and Support Officer here at the charity. As someone who has experienced depression and anxiety from a young age, I think it is so important that we're able to discuss mental health openly and explore these topics together to gain a better understanding. And it's great to see so many of you here today. Today's session, Is It Just My Anxiety?, presented by Anxiety UK, explores medical gaslighting and diagnostic overshadowing experienced by those living with generalised anxiety disorder. They will be sharing their research findings and providing some recommendations for what to do for people who feel this has happened to them. I hope you enjoy watching. Thank you.
Well, good morning, everybody. I'm Dave Smiths, and I'm here on behalf of Anxiety UK this morning to talk to you about the presentation I'm going to go through shortly with you. Is it just my anxiety? But before we start, a brief bit about myself. I worked for Anxiety UK for over 12 years. I actually retired in May this year. So for the last couple of months, I've been doing the odd bit freelancing for Anxiety UK. I was initially marketing and communications coordinator, then I became operations manager, operations director. And at the end of my tenure with Anxiety UK, I was the director of communications and external affairs. And during that time, I worked a lot with the charity for civil servants, and we presented many occasions training and met the team there. And I continue to support Anxiety UK as a freelance, doing podcasts, webinars, training, and these kind of events. So that's a little bit about me and why I'm presenting to you today. And we're going to be looking at a piece of research that we did at Anxiety UK a couple of years ago now. It was called Medical Gaslighting and Diagnostic Overshadowing, and it was a piece of research we wanted to do for quite some time, because we'd been hearing and anecdotally for quite a few years that people living with anxiety were experiencing what they were calling sort of what we refer to as either medical gaslighting or diagnostic overshadowing. So this was happening when they were seeking healthcare advice for their conditions other than their anxiety. So they're going to the doctor, or they're speaking to the practice nurse, or even just in some cases trying to book an appointment with the doctor and speaking to the receptionist. And they were asked, well, what is it you want to talk about? You know, what's the condition you're presented with? As you go in to see a doctor, you tell them what's up with you, don't you? And lots of people were telling us that they weren't being taken seriously, particularly people with lived experience of anxiety who'd previously got help and support from their GP or other practice nurse or whatever with their anxiety. It's obviously on your record, you've got anxiety. And we know that quite a lot of the symptoms of anxiety do sound and feel like other conditions. So just as an example off the top of my head, racing heart. If you've got a fast heart, that could be anxiety. You know, when you're feeling really anxious, your heart starts pumping really fast. But of course, that could be a totally different problem altogether. It could be, you know, something that's much more serious than just anxiety. And it was that fear of not being taken seriously that led us down this path. And as I say, for some time, anecdotally, we'd heard this from lots of people contacting the charity. So we decided to do something about it and say, well, there's two areas you want to look at was medical gaslighting, which is defined there. It's the behaviour in which a physician, a GP, a medical professional either dismisses or downplays these symptoms or attributes them to something else, such as a psychological condition. And this is happening either because of conscious or more often the unconscious bias. Or the other definition, of course, the other area that could be misconstrued for is this, what we call diagnostic overshadowing. And the definition of that is that failure to see a problem because the symptoms are common to more than one condition, a bit like the one I described a second ago. And then, therefore, that healthcare professional, the doctor, the practice nurse, whoever, incorrectly attributes those symptoms to that other condition. And quite easily, we can understand, I'm sure, with the example particularly that I've given, that if it's a racing heart, you say, oh, it's just your anxiety. But actually, it could be a problem with your heart. That could be really serious. And another interesting comparison is panic attacks and heart attacks. Indeed, we do a lot of training around those two different things about panic attacks as part of our anxiety training packages. And one of the things we talk about when we're doing panic attack training is the similarities in symptoms between panic attacks and heart attacks. And often I will say, if you're ever not sure, if you've got that doubt, rather than just take it for granted that it's a panic attack, we would always encourage you to call a paramedic, to call a doctor, to get somebody professionally to make that judgment on whether it's a panic attack or a heart attack. Because clearly, if it was the latter, it could be very serious. And if it turns out it's only a panic attack, I've always said that a paramedic would never complain about you being overcautious. So we can see why and how it can easily happen that a healthcare professional, whatever their role, could assume that the condition is just down to your anxiety. So hence the title for this session, of course, is it just my anxiety? And many of you may have had that experience or may be wondering, well, what's happening here? I'm not being taken seriously. When we set out to do the research, we wanted to get beneath the skin of those issues. As I say, we'd heard about it anecdotally for quite some time. So we targeted specifically people with generalized anxiety disorder, or GAD as we call it. And to get a diagnosis of generalized anxiety disorder, it's normally people that have had or experienced anxiety for a longer period with no obvious explanation. So when we say a longer period, we say it's normally more than 6 months. And I say that because sometimes, of course, we can experience anxiety for reasons that are short-term or short-lived. A good example is if you're taking an exam, we're going to feel anxious about the exam, aren't we? In a few days leading up to it, the night before, but normally the day or so afterwards, that release has gone. You've got over that initial anxiety of doing the exam. You've done it. It's out of the way. So with something like that, it wouldn't last for more than 6 months, obviously. But if you're living with anxiety, there's no obvious reason or explanation, and it's gone on for more than 6 months, it's normally then classified as generalized anxiety disorder. So just to put that into context. And we also wanted to see, not just talk to people who had generalized anxiety disorder, and of course people who don't have that, just to get a comparison, as you'll see from some of the evidence and some of the data that we collected, but also to research and understand if GPs themselves, healthcare professionals, were aware of these issues. And so we talked to some GPs as well as part of this process. We conducted the initial survey amongst the general public and our Anxiety UK members in May 2023. Now, included in the survey were 259 people aged over 18 without a diagnosis of generalized anxiety disorder, and they were recruited from market research company's sample panel. But then the people that were living with GAD were from our pool of Anxiety UK members. We had surveyed 328 of those who were members of the charity and contacted by us to complete the survey, of which of those 328 people, 237 reported that they were living with generalized anxiety disorder. Now, the initial results were quite encouraging, and we'll drill down into these a little bit more in detail, but just to say it's encouraging in as much as we'd always suspected that this was the case, but it was always, as I said right at the outset, it was almost very much anecdotal. So it wasn't down to facts or evidence based. So what we were doing here as part of this research, and should maybe add that the funding for the research came from a legacy. Somebody left us a legacy in their will, and we wanted to do something really positive with it that had previously been on our radar to do, but was not the top of the priorities. Now we had the funding to get this done. So this was really encouraging when we saw the initial headline figures from the data that come back, that 44% of the people with GAD reported that they have or may have experienced problems getting professional medical help for a physical health condition or disease because of their GAD. So what these people were saying to us is, yeah, I've struggled to get help because it's been dismissed as, oh, it's just your anxiety. Hence, we want to drill down into this a little bit more deeper. And let's say 44% is almost half. That's a lot of people. We then would aim to look and drill down a bit more into that, to look and understand exactly what kind of issues people with GAD were facing when it came to to getting help for their physical conditions. Just to quantify or explain the question that we asked and where we got those figures from, 44% was the number of people who said either yes or maybe to the question that's there: have you ever experienced problems getting professional medical help for a physical health condition or disease that was not your generalised anxiety disorder or any other mental health problem because of your GAD? So again, we were trying to explain and understand exactly what we were asking people and why we are confident about these findings. The other thing that we looked at was at least half the people with GAD, we looked at whether it was medical gaslighting or diagnostic overshadowing. So at least half of the people with GAD who experienced issues accessing the care that they perceived as medical gaslighting included not having their symptoms taken seriously. It was 53%. So again, quite a significant number of people with GAD said that they felt that they were not having their symptoms taken seriously, as opposed to 15% of people without GAD. So again, you can see there's quite a distinct difference between those who are living with GAD not being taken seriously, over 50%, whereas only 15% of people without GAD who had obviously no record, no history of living with anxiety. Therefore, there was no conscious or unconscious bias applied to their presentation. And then equally, having their symptoms ignored, denied, dismissed by the healthcare provider, again, was significantly higher, 51% as opposed to 24%. So you can see there's a real conscious difference between those people living with GAD and those people not living with GAD. So it's fairly reasonable to assume at this point, and that the evidence has started to stack up, that medical gaslighting is happening far more commonly, and it's more predominant with those people that are living with GAD. And then we looked at the diagnostic overshadowing side of things. So approximately 1 in 5 people with GAD said that they would be considered that their experience reflected diagnostic overshadowing. 23% of the respondents with GAD who experienced those issues. So the symptoms of a physical condition, so increased heart rate, sweating, breathing issues, was mistaken for their GAD, compared to 7% of non-GAD respondents. So again, we can see quite a distinct difference, 7 to 23%. And imagine you're turning up at your doctor's surgery, you're talking to the practice nurse, or you're talking to your GP, and you're talking about breathing issues or an increased heart rate. There could be signs and symptoms of a serious condition, a physical health condition that could be potentially quite dangerous for you to experience. And imagine you being told, well, it's just your anxiety. And you'll be thinking, hang on, is it just my anxiety? Am I worrying about nothing? Understandable why we're looking at these particular topics, isn't it? So we also then, again, drilling down a little bit more into the findings, we found that nearly 1 in 3 people with GAD who reported that GAD complicated their ability to get an accurate diagnosis. And 20% of those people who experienced issues accessing care felt that their healthcare professionals were not aware that anxiety could be a symptom of an underlying physical condition. So what we're saying here is, as well as you might already have a history of anxiety in some cases, or those people even necessarily who didn't have a history of GAD, were finding that their symptoms of an underlying physical condition wasn't necessarily being attributed to their condition, but the professionals they were speaking to were not aware that anxiety could be a symptom. So it's also, again, adds to the picture of how and why medical gaslighting or diagnostic overshadowing, either or, could be happening when you're going to see that healthcare professional. It also teased out in the survey the impact on the quality of life that people were expecting, were finding out. So, again, just to put into context the size of the research people that were involved in this, the size of the sample. Those with GAD was 105, those with non-GAD was 259. So a slightly higher proportion of non-GAD participants. But the people with GAD who reported experiencing issues accessing care were paid, they felt, a bigger financial price as a result of their issues. They were more than 3 times as likely as those without GAD to report that their jobs prospects were impacted. So what these people are telling us is that their job prospects are being hampered by the fact that they had GAD and were having experiences accessing care, and therefore that was having an impact on their job prospects. And it's at that point you start to realise why it's important that medical gaslighting, diagnostic overshadowing, is potentially a big problem. It's not just that they're not getting the care, but it's having an impact on their overall quality of life as well. And that could be for a multitude of reasons. It could be because they're taking more time off sick because they don't feel well, but they're not getting the help that they need. And because they're taking so much more time off sick, they're not got a good workplace record. It's impacting their ability to get promotions at work because they've got a sickness record that's not healthy. A whole bunch of reasons, but people who were having those problems were reporting that they felt their job prospects were impacted by this. And interestingly, some other data, when we drilled down and we broke the data down into different age groups and also different genders and other aspects, and we saw that the people between 18 and 24 and people between 55 and 64 felt that their job prospects were impacted more than those overall. So again, it showed an impact based on a higher impact on those in those particular age brackets than those overall. So again, it was showing some really interesting data that made it even more important that we understood what's going on. So again, some other breakdowns here. People with GAD report experience issues were also more than twice as likely to report being compelled to seek private care. So we're saying here, 43% of these people who felt that they were experiencing medical gaslighting or diagnostic overshadowing, as a result, they were seeking private healthcare. They didn't trust the system to the extent that they felt they needed to get a second, or in some cases possibly even a third or more opinion from a private health provider. So again, it's having an impact financially on these people. Similarly, people between, again, those ages of 18 to 24, 55 to 64 were more likely to seek private healthcare. Again, were higher than the average. So the average was 43. 18 to 24, it was higher at 58, and 55 to 64, it was higher at 61% compared to that overall average. So again, those people in those two brackets felt even more compelled to seek private healthcare because they felt it was a bigger problem for them. And equally, women were experiencing the issue more prominently than men. So were more likely than men to seek private care. Sorry. So again, 46% of women compared to 30% of men. So again, we can see how it has an impact. So if you're an 18 to 24-year-old woman, you have 46% chance that you're going to seek private healthcare if you're not getting the help and support you should be getting down because of medical gaslighting and diagnostic overshadowing. So what are we going to do about it? Oh, sorry. So that was just a sample of the of the issues that we saw and we highlighted from the vast amounts of data that we collected through the two surveys with the members and the general public. As I said at the outset, we also wanted to get a feel from the medical professionals and the GPs, the doctors, and how did they feel about it. So we also did a survey amongst them. Well, UK-based GPs between, as it says there, August to September 23. We targeted 200 GPs who had reported having at least one consultation with a patient who'd been diagnosed with GAD or a condition other than their GAD within the past 2 years. And that was 154 GPs without any extended roles or any specialist interests. and 46 with specialist interests. So that might be a particular a consultant in working in hematology or rheumatism or some other special role. So it was a mix of, it wasn't just frontline GPs. So what did we find from there? Well, it was interesting because nearly 70% of all GPs believe that bias, including unconscious bias, often, very often, always makes it more challenging for patients with GAD to receive a diagnosis and or access care for their known GAD conditions. So that was fascinating, really fascinating for us, in effect, that such a high percentage thought that certainly there was a degree of bias or unconscious bias. So it's almost like because what we're very keen to do is this wasn't about bashing GPs or nurses or anybody else. This was about identifying, is there a problem that exists that we feel anecdotally exists, but we had no evidence for? And it's fascinating that many of those in the profession felt that it was happening. In fact, over 95% of those reported that bias may at least occasionally make it more challenging for them to receive that diagnosis. Again, a much higher percentage than we expected. And no GPs claimed that bias never impacted GAD patients' ability to receive a diagnosis and or care for non-GAD conditions. So it was really interesting that everyone thought there was a degree somewhere along the line where either consciously or unconsciously it would have an impact on you. And this, if you are somebody who's living with anxiety, and some of you, watching and listening to this may have experienced it yourselves, that where you've had that issue where you've had something that's gone wrong, you've not felt well with a non-GAD related condition, you've been to your GP surgery, or you've even been to hospital outpatients or whatever to see somebody with this problem, about this problem, and you've come away feeling, well, they just put it down to my anxiety, they've not believed me, and you're left as the title as it said, is it just my anxiety? Is left what you're left thinking. So some more interesting data from the GP's survey side of life. So we felt, and this again shows us a distinct difference in gender of GPs, that female GPs were more likely than their male peers to report that bias very often, or always makes it more challenging for patients with GAD. So amongst the female GPs that we surveyed, 75% of them felt it was more likely that bias very often, or always makes it challenging, as opposed to 64% amongst the male GPs. So something to bear in mind, that obviously they just had a difference of opinion, but it was their view from their experience. And we're not talking about, we're talking about people here who've gone through a lot of training, as you know, to become a GP. They'll have done at least 7 or 8 years of the training. So, these are people who thought carefully about what their experience was, and they felt that there was clearly a bias or unconscious bias there. And equally, there was a slight difference in those GPs that we interviewed who had more experience. So those GPs with over 25 years of experience report this bias less often than others. I think that's a generational gap difference in view or opinion. I think less than half of them believe bias was often or very often always made it more challenging, compared to 70% of GPs overall. So what we're saying here is the older, more experienced GPs were less likely to feel that bias existed. And that may just be that they felt that their experience made it easier for them to be more open-minded about it, less prone to being biased about these kind of thoughts and conditions, or in their view, it was not something that was a problem as much as the younger, maybe less experienced GPs. But for whatever reason, there was a difference of opinion there. So when we started talking about diagnostic and some of the questions around diagnostic overshadowing, most GPs felt it was more challenging for them when diagnosing or treating a patient with GAD compared to the general population. So what they're saying here is that they recognised and almost understood that a patient presenting with GAD would make it really more challenging for them to diagnose or treat that patient compared to a non-GAD patient, because of the diagnostic overshadowing, the likelihood of diagnostic overshadowing to appear. And I guess what they're saying is it's easy for them to, or more challenging for them to decide and identify when a symptom is GAD related and therefore it's appearing because of the anxiety, or when it's not related to the anxiety. And it is. I mean, to the ordinary man and woman in the street, we would go back to what I said earlier about the panic attacks and the heart attacks. Identifying a particular symptom that could be a panic attack or a heart attack symptom can be very difficult for the average man or woman in the street. Why we say, if you're not sure, and it's very understandable why you would not be sure, get a professional opinion. And what we're saying here is it can be just as challenging, even for trained, qualified and experienced GPs, to identify when a symptom is anxiety related and when it's not. Majority of GPs believe insufficient time to engage with the patient and understand their symptoms complicates care for people with GAD. So again, something that we all feel probably quite often things when we go to see a doctor, and it gets talked about a lot in the news, doesn't it, that they've only got 10 minutes to spend with a patient. I know when sometimes I go to see a GP, and I've been to see a specialist recently that spent 15, 20 minutes with me. I came away feeling actually quite guilty that I'd eaten up more time. But sometimes they need more time. And what I've found, in my experience, is a good thorough GP will not stick to that, look at that clock after 10 minutes and worry about getting you out. If they need to delve a bit deeper or ask you some more questions, they will. But in some surgeries where they maybe have a big queue waiting outside and they haven't got sufficient time to really dig a little bit deeper, they feel that there's it makes it even more difficult. So something to bear in mind. Again, female GPs were more likely to cite insufficient time, 74% rather than 60% of males, and a lack of continuity of care, which is another interesting factor. So 57% against 39% compared to their males, as factors that add to the challenge. So we're building up a picture here, isn't it? It's not just about, is it your anxiety or is it not your anxiety? Have they got enough time to actually dig beneath the surface for it? And I'm not sure why female GPs would cite insufficient time or lack of continuity of care as a greater challenge than their male peers. But it was just interesting that the data we got back from these surveys identified that was their thoughts and feelings on this. Continuity of care, again, my own experience, and you'll all have your own personal experiences. I often get to see different GPs when I go to my surgery. They don't have one GP allocated to just one particular group of patients. I can quite often see 2 or 3 different GPs, and again, that lack of continuity of care could be a factor in that. So somebody who maybe doesn't know you that well might think, well, it's just their anxiety, and not really delve a bit deeper, where somebody who knows you better might look a bit deeper because they think, hang on a minute, we know they've got anxiety, but this does sound like they're worried about something that maybe not be anxiety related. Over half of GPs report the shift from face-to-face consultations to telephone consultation that impacted patients living with GAD more negatively. So this is again an interesting, really valuable piece of data from the research. What we're talking about here, of course, as I'm sure you all recognise, is the shift from face-to-face to telephone was driven primarily in recent years, of course, by the COVID pandemic, when none of us were allowed to go and see them. And I'm sure many of you will experience that, certainly like myself, that our surgeries have not gone back to as frequent face-to-face consultations as they had prior to COVID. In fact, you have to have a really good reason to get a face-to-face consultation. That I think 60-70% of our consultations from my surgery continue to be done by telephone post-COVID, because it's identified a new way of working, and in some cases that makes it more efficient, makes it better for the patient, and sometimes it is more convenient. I mean, I've already referenced the fact that I retired in May, but prior to retiring, I didn't go back to the office after COVID. I continued to work from home until I retired, because it was more practical. It was cost efficient, and lots of reasons. So, lots of practices that we learned during COVID have continued post-COVID, but not necessarily always for the best. So, and it was interesting that particular information came out from the survey, that they thought that the less face-to-face and more telephone consultations had impacted them negatively. We talked about experience briefly earlier. Again, the GPs with experience, 11 to 15 years of experience, more often reported the shift had negatively impacted it. So it's interesting that those with more experience preferred, by the sound of it, they felt that the shift to telephone had impacted negatively those patients with GAD. I suppose those with less experience had not known anything else, or had found it already worked fine. However, most GPs aged 65 plus, 60% of them report that patients with GAD have not been impacted more negatively or positively than the general population. So again, we've got quite a distinct difference there. So I think we'll just draw that out to show that in different groups of GPs, there are different views and different opinions. And most GPs felt that anxiety can very often be a symptom of an underlying physical condition. In fact, over 90% report anxiety at least occasionally be a symptom of underlying. So again, there's a recognition that anxiety can be a factor of your overall physical condition, which is a good positive thing if they won't just dismiss it as just your anxiety. Some more findings from GPs here that we'll look at. More than 95% believe that people with GAD occasionally experience difficult delays accessing care for non-GAD conditions due to bias or unconscious bias. So again, they're recognising and accepting there could be a delay in accessing that care because of your experience or your known diagnosis of GAD. 6 in 10, 58% report this bias very often always leads to difficulty delays accessing for care for people with GAD. And the majority of GPs said all tools, resources and support detailed in the survey would be helpful when treating patients with GAD, especially support from extended role GPs, tools translated into different languages, and extended appointment time. So there was a section in the survey saying what tools and resources did they feel would be helpful, and the majority all felt that all of those would be helpful when treating all the different options that were put in front of them. So overall, it was interesting to see the findings from the GP survey very much paralleled what we found in the patient survey. So people with GAD experience diagnostic overshadowing and other biases that prevent them from accessing and receiving the quality of care, and further tools, support, resources are needed. So overall, what we managed to achieve was some really valuable, in-depth data and views of a lot of people, both those living with generalised anxiety disorder and GPs and other healthcare professionals supporting and treating them. So all that anecdotal suspicion that either medical gaslighting or diagnostic overshadowing was having an impact on patients that lived with GAD was proven to be no more than just anecdotal. It was actually happening out there. So one of the key messages that we can take from this, well, as I said there, the the two conditions, or the medical gaslighting and diagnostic overshadowing, are experienced by those living with GAD, and that supports that anecdotal reports that were previously identified. 44% reported that they've experienced it, and 20%, 23% had experienced the diagnostic overshadowing, and that we've talked about. 70% of GPs believe that bias, including unconscious bias, often, very often, always makes it more challenging for people with GAD to receive a diagnosis and or access to care for their non-GAD conditions. So if you're a person that's living with GAD and you feel that you've got a totally different non-GAD related physical condition, something that it could be a breathing difficulty, it could be a heart problem, it could be a multitude of different physical conditions that were not being caused by anything to do with your GAD, you could potentially be, facing some kind of bias or unconscious bias when you go and see your GP or other health professional. And people with GAD and GPs believe action needs to be taken to improve health outcomes for those with GAD experiencing non-GAD conditions. So there were some really key messages came out of that piece of work, which we then took away and thought, well, okay, what are we going to do with this now that we've done all this work, we've spent all this time and money and drawn all this data together and identified what's going on. What are we going to do? So we went away and thought, well, we need to put this to practical use. So our key recommendations that came out of this piece of work is that guidelines should be developed for the clinicians, that's GPs, healthcare nurses, clinic nurses, even the clinic reception staff, to improve the detection, the diagnosis, and the treatment of non-GAD conditions in people with GAD. And what we're saying simply is, don't just put it down to that anxiety. You're sat there thinking, should I go see my doctor or not? Because this could be just my anxiety. And if you've done that in the past and you've gone to your doctor and they've said, no, it's just your anxiety, the next time you've got something else that's worrying you, will you just say again, is it just my anxiety? Will you worry about going to see them? Or, will you hopefully now be a little bit more confident in being able to go and have a conversation with them? So we recommended that resources and support for people with GAD seeking care for those non-GAD conditions in primary care settings should also be developed to reduce, so resources and support developed to reduce the likelihood of being affected by MG or DO. And this could include, for example, production of a conversational tool for people with GAD to use when consulting healthcare professionals, including your GP. And that training and awareness initiatives should similarly be developed to address bias and diagnostic overshadowing in people with GAD, especially targeting male GPs and those with more than 25 years experience. So what we're saying there is training and awareness should be developed. And then so as a result, we actually developed some toolkits ourselves. And there's two toolkits. There's one toolkit available for people that are living with anxiety, living with generalized anxiety disorder. And if that's you, if you're watching this and you're listening to this and you want to have a read of that, the link is there. I will make sure that these links are shared as well alongside the recording this morning that you're watching. And you can, there's all sorts of information and advice in there. It tells you about the kind of questions you can ask, where you can get extra help and support. And it's a really valuable toolkit. There's also one we developed for the healthcare professionals, again, for them supporting anxiety. And one of the tips and one of the pieces of advice that we give with the toolkit for people with anxiety is next time you need to go to see your GP to talk about a non-GAD related condition, physical condition, is take a copy of that healthcare professional's toolkit with you and give them a copy of it, or send a link of it to your surgery. And then there's the link there finally for the full report. it's quite an in-depth report. There's a lot of detail in there. I've hopefully given you a good flavour and insight into it, but it's there's a lot more detail behind it if you want to read it and look at it. And again, that can be the copy of the report can be downloaded from our website, and that the link for that is there as well. So that concludes the presentation. I'm now going to open up for a Q&A session, and hopefully we've generated some thoughts and interesting questions for me to now answer for you. Thank you.
Hi, Dave.
Hello, Lisa. Hi.
Just waiting to see if your face pop up on screen. But what an incredible session that was. It was so powerful, so informative. My goodness, what a necessary piece of research that was, Dave. You must have, even as you were doing it, you must have been really feeling the import of all of those statistics that you're finding.
Yeah, absolutely, Lisa, and great to see you again. It's been a while since we've had a chat. So, it was something we'd wanted to do for actually quite some time. We'd talked about it. We knew from the people that we were supporting and helping, people phoning us on our helpline that we used to have. It was coming up time and time again that I go to see my GP and they just say that it's just my anxiety, and I know I've got something else, a physical illness that they're not looking at. So it was very much anecdotal, as we said right at the start of the report, that we had this fear that this was happening, and I think having that concern, that those anecdotal feedbacks confirmed to us through this research was really a boost to us, because we committed and invested quite a lot of money in doing the research as well. So it was great to see that those concerns were validated. And I think what really struck me, not just that the people that with that lived experience were providing that validation, but the GPs and the healthcare professionals themselves were adding to that validation. So a lot of them said, yes, hands up, unconscious bias. Yeah, we probably do think that without really realizing that we were doing it. Which I think, I think I said in the presentation, it's not about pointing fingers or laying blame on anybody. It's not about criticizing anyone. It's a natural human reaction, isn't it, to say, oh, well, it's probably just your anxiety. Actually, it might not be. So let's be, give people the opportunity to look a bit deeper and just eliminate that it's not just their anxiety.
Yeah, I think really from me, Dave, that was one of the most startling statistics when you highlighted the number of GPs who acknowledged that probably is something. But I thought even what was really more interesting then was the breakdown in terms of those who really, maybe those who are slightly older or those who have more experience tend not to acknowledge it as much. So yeah, I thought that was really fascinating as well.
There's a lot more detail behind that as well, Lisa. I tried not to go too deeply because we're going to be here for another 12. Yeah, but I mean, if anyone's really interested, download a copy of the full report and have a look. But there's a lot more detail. But again, try to highlight some of the key nuances. But it is important to say that different age groups, different genders, all sorts of things or factors have an influence.
Yeah. So Dave, we do have a couple of questions, and I think you might have already kind of partly answered one, but I just want to clarify. The question has come in: can I take a copy of that guide or that toolkit to my GP? I think you mentioned it's okay for people to download.
Yeah, absolutely. I mean, I think I put the link on the end of the presentation there, and I think I provided you with a copy.
Good, so we'll make that available to people.
Yeah, I think it's in the delicate pack, isn't it? So by all means, there's two guides, one for yourself, so you look at it and give yourself some tips, and it frames how you can ask some of those questions, helps you overcome some of those challenges when you're having those conversations. And also the healthcare professionals guide gives them some things to think about and consider when they're dealing with somebody. And I say they can be downloaded. You can take a copy to your surgery, and I'm sure they'd welcome it.
That's super. And actually something that's connected to that is another question that has come in, and it probably does follow up on that. So for somebody with anxiety. Actually, that might feel a difficult thing to do. So someone said, is there any tips to keep my anxiety in check, especially when I'm having to talk about it?
Yeah, I mean, particularly if you're having that conversation with your GP or a healthcare professional, say using that guide to help you open that conversation. Say, I've been reading this, and if you're going to be introducing something like that, you're so focused on what you want to talk about, you sometimes forget about it yourself. You forget the anxiety. So it's more when you're worrying about it and thinking about it. Whereas if you've got your mind concentrated on something else, it might not happen. But more generally, it's what I think the question might be asking. Deep breathing exercises is a great way to try and keep that anxiety in check. There is a deep breathing tool on our website, which is which can be found very easily, and it's also available on our app if you download the app. And it's just an infinity circle that you just breathe in, hold it, breathe out. And the key with breathing exercises, any kind of breathing exercises, is to your exhale, your out breath is longer than the inhale. So you hold it and then breathe out really, really longly. And do that for 30 seconds or a minute, and you really will feel it helping you feel less anxious. And I think the thing about these breathing exercises, you can do them now, and I can stop talking. You can go on to answer or ask me the next question. And while you're asking that question, I could be doing that breathing exercise in the back, and nobody would even notice. It's something you can do very subtly without drawing attention to yourself. And you can do it anywhere, in a meeting, on the train, on a bus. Just practice that breathing exercise. If it's something that happens a lot, just that breathing exercise, and it's a way to just calm yourself down.
Oh, that's fabulous. And again, then that question really nicely leads us into the next one. So someone has said, are there any tips just for dealing with GAD at home and at work? So you've mentioned breathing techniques. Anything else we could add to that, Dave?
Yeah, I think and sometimes it's about letting people know that if you can have conversations, particularly in the workplace, and say, sometimes when I'm feeling a bit anxious, this happens or whatever. So people around you can understand and support you, and that's very difficult to do sometimes, having those conversations. And a lot of times people don't get help and support about the anxiety because they worry about being judged. They worry about the impact it's going to have on their work colleagues and how they think of them and how they perceive them. So I think, sometimes having had those conversations so people know and understand, it can be more supportive and compassionate to you. But then just generally, it's about managing. Have a look at are you sleeping well? Are you managing your sleep well? Are you eating healthily? Are you exercising? Are you practicing mindfulness? I know we had a mindfulness session before we started today's. I think you've had them every morning this week, haven't you? Mindfulness is hugely beneficial. So lots of things. I mean, people don't realise the importance of. We talk about active, being healthy and fit from a physical point of view, but being healthy and fit from mental health point of view is equally as important. There's a reason why we were encouraged to go out and have a walk for 1 hour a day during COVID. It wasn't just about keeping our health physically well, but it's mentally well as well. So, and what we eat and drink is, it can also have an impact. We've done huge studies on the impact of food and the gut microbiome and how that affects the brain. So there's lots of evidence and research around now that show that eating healthily is important for your mental health as much as anything else. So lots of things there you can look at to help you manage it.
So that's really interesting. You mentioned all those things, and you spoke about the resources that you've provided being in the delegate bag. And just to say to anybody who's watching, in that delegate bag, we've also got the mind bites, those little mindfulness resources where people can just incorporate those into the things they're already doing. They're not necessarily having to find another half hour in the day to do that, but the things they're already doing, how can we incorporate it? We've also got in our delegate bag resources from an organization called Vital Nutrition. And we've got a series of half-hour presentations from them, some of them looking at improving our sleep, improving our microbiome, lots and lots of resources thinking about how our eating habits also link to our mental health. So some great resources that tie in with what you're saying there, Dave. Thank you. Now, this is an interesting question coming in from the other side of that coin. So what if we are the person with someone who's experiencing an anxiety attack, maybe a panic attack? How do we support them? Maybe we're not familiar. What are we doing to do?
I think first and foremost, think of the environment. Where are you? Are you in the middle of a busy office where loads of people are staring and looking at them and making them even more anxious because they, so first of all, what's the environment? If you can get that person to a quiet room, get them to somewhere that they feel less, more safe, if you like. And if you're in a busy room or a busy office, try and get them into a quiet corner, a quiet room, a quiet corridor, somewhere a bit more private, a little bit of privacy as you would expect. And then first thing, go back to the breathing. Try and get them to get their breathing under control. Focus on their breathing first and foremost, because invariably somebody having a panic attack or anxiety attack, they're quite hyperventilating is quite a common symptom. So try and get them to calm their breathing down, get their breathing under control, focus on their breathing. And whilst they're focusing on that, you're distracting them from thinking about the panic or the anxiety and what's caused that. So we're trying to distract them in a way. And there's all sorts of then different distraction techniques you can use. So, okay, now you've got your breathing under control. Try and tell me one thing you can smell, 2 things you can see, 3 things you can hear, 4 things you can so do something like that. Or maybe get them to start counting backwards from 100. So 100, 99, 98, 97. Focus on something that's distracting them. Trying to get them back. So a panic attack is effectively it's a sudden spike of anxiety. It's if you can imagine electricity, we know that you have a sudden spike of electricity, the fuse blows, doesn't it? It blows in your house. It's because a sudden surge of electricity. A panic attack.
That's what we're feeling.
Yeah, it's that sudden surge of anxiety. So you might be regularly anxious, but all of a sudden there's this just sudden surge of it. From sometimes there's no reason for it, or there might be something that's triggered it. I can remember a few years ago doing some training when the Shard in London, the big tall building, when that first opened, they've got this lift that takes you to the top in about 30 milliseconds, and people were coming out of the lift and seeing this fantastic view across the skyline of London. But it was such a surge of anxiety or such a rush of anxiety, it was causing people to have panic attacks. So we did some training with their stuff.
It's at the top of the Shard?
At the top of the Shard, yeah. People having panic attacks because they suddenly... So
oh my goodness.
It's about getting that under control, bringing that sudden rush back down to a manageable level. So breathing exercises, distraction techniques, doing something that takes their mind off it.
Fabulous. So we're coming almost to the end, Dave, but I think we've got time. We've got a couple more questions. Yeah. So someone has asked, is there a simple sentence? Is there just something very simple and straightforward we could say when we feel that things are simply being attributed to anxiety or perhaps autism or something else, to just stop having everything put down to that one condition? Is there something very simple we could ask them to address?
Yeah, I think I just say it exactly like that. I would say, I think I haven't got it to hand because I'd have to go off onto another screen. But in the guide that we've suggested that you download, I'm sure there's some examples of ways you can phrase that in there.
Brilliant.
But I think just have that open, honest conversation. Just say, it feels as though you're just putting this to my anxiety. Can we not just look a little bit deeper and just examine some other areas, or have that open, honest conversation if you feel capable and comfortable doing it, or maybe get somebody to go with you and advocate that for you.
Wow, that's a great idea. That's a great idea. Yeah, if you have someone that you trust, you feel confident in, let them maybe do that speaking for you. Another question: how can we, just in general, how can we encourage more conversations around anxiety, and especially for men?
I think, particularly in the workplace, it's important to show that it's taken seriously. I think that often people won't talk about it because they fear about getting judged, or people putting them down, or taking the mickey, or not taking it seriously. So I think from a workplace perspective, demonstrating that it's taken seriously, it's supportive, that you don't judge people, you don't sort of you encourage them to have those conversations, that you have a very open culture, and the culture of any organization is always difficult to you can't just impose a culture. It's something that grows and develops over time. But I think you can, I mean, I know from working alongside you guys for a number of years that the culture is very positive and supportive within the civil service across the board in general. But obviously, you're also a very big organisation that covers many different departments in very many different locations. So not everywhere might be, you know, identical in that respect. But I think, you know, making people feel comfortable and talking about it, making sure that they don't feel they're going to be judged, that they're not going to be, you know, they're going to be taken seriously. They are going to get help, and you know, I think we're breaking those barriers down. It's not just, you know, in your workplace. I think it's in society in general. We still have trouble talking about some of these things, but I think, you know, lots of things like campaigns and people, high-profile people like Prince Harry, Prince Edward, and Stephen Fry and William talking about these things has helped. High-profile celebrities talking about it, you know, sports stars. It's about normalizing that conversation, saying it's okay. You know, people often think they're alone and that it's just them that's feeling like that. But it's 1 in 4 people will be living with anxiety at any given time. So, you know, if you're in a room of 12 people, there's probably 3 or 4 of you in that room feeling the same way.
Yeah, do you know, funny, David, Dave, I was thinking when you were speaking earlier, you know, about maybe sometimes it helps us if we just say to a colleague, you know, we were talking about how can we maybe deal with anxiety when we're at work, let a colleague know, I'm actually feeling a little bit challenged today, I'm feeling my anxieties rising today, and speaking to somebody. And I was just thinking when you were saying that, we might be surprised to find out how many of our colleagues may also be experiencing those kind of things. And so by maybe being brave enough and getting our courage up to just make that statement about ourselves, we might even be able to open that conversation up for other people who have been struggling a little bit. Actually, conference sessions like this are a great way to do that, isn't it? To just be able to go back to colleagues and say, oh, you know, I was watching this session, let me tell you something really interesting. And of course, all of these sessions are available to watch on demand, so we can encourage colleagues to maybe join in and then make that a starting point for a conversation.
Yeah.
Dave, it has been an absolute pleasure. As always, it's a pleasure working with you and the wider team at Anxiety UK. Thank you for that phenomenal session.